Going to talk about choosing wisely to mitigate financial toxicity in cancer care in Africa. Today the presenter was supposed to be Mr. Zawadi Secha, but unfortunately he couldn't make it due to unavoidable circumstances, so I'll take you through this session. In this session, we're going to define the problem, that is financial toxicity, and we'll also identify the solutions to financial toxicity which are affecting cancer patients. We can see there from the diagram that that is a patient, a person who's been diagnosed with cancer and has got a multiple number of stresses. That person has got physical stress, mental stress, emotional stress, and financial stress. So we are going to concentrate on the financial part, which is the financial toxicity, which has got, sometimes we think that it only has social implications to our patients, but it also has clinical implications to our patients and relatives together with the society at large. The key points for this presentation will be financial toxicity. This describes the problem a cancer patient has related to the cost of treatment. Now, there are a number of studies that show cancer patients and survivors are more likely to become bankrupts than people without cancer. Why is this the case? Because we know that cancer is very expensive to treat. At the end of the day, it might lead to bankruptcy of the patient or the families or the caretakers. So the level of financial toxicity will depend on the number of household factors. These household factors might be like family budgets, how many kids does that patient has, are they in school, are they married, how many dependents does that patient has. So with all those household factors, beside the cancer-related costs, they can intensify the level of financial toxicity to the patient. Cancer treatment can affect both paying bills together with ability to work. So it is very essential to have health technology assessment like researches and financial risk protections like savings, loans, or health insurance, so as to increase the quality of life or quality of care of a patient. So what is this problem, this growing problem that is called financial toxicity, especially to cancer patients? Financial toxicity is the negative impact of cancer diagnosis on the patient's financial well-being, resulting from direct or indirect cost. Most of the times, we tend to concentrate on the direct cost, hence ignoring or neglecting we concentrate on the direct cost and we neglect on the indirect cost. Indirect cost can be costs like parking fee, bus fare fee, coming to and from, attending chemotherapy and radiotherapy at an institute. That can either be a lodging fee for the patient or the caregivers. It's a number of factors. So the possible consequences of financial toxicity can include material loss. One might need to sell something in order to be able to afford the cost of treatment, or psychological distress, or even the person can have inappropriate coping strategies. Like some of them, they can even lose follow-up of treatment, and they look for other alternatives like religious people or traditionalists and things like alike. So today, financial toxicity is estimated to affect approximately half of cancer patients. Yesterday, there was a presenter who talked about 70% of patients in Ocean Road are being exempted. So that means it can give us a picture that majority of patients, they do consume or they do use out-of-pocket expenditures. So financial toxicity, this is a growing terminology, it's a growing problem, and the first research was done by First Hint in 2011. and another one was done in 2013, and they spotted this problem, and they thought maybe we are supposed to do a lot of research in this area so as to increase the clinical impact to our patients. So what a cancer diagnosis can mean to a patient mostly is financially. The first thing that when you diagnose a person, the first thing that that person thinks is, how am I going to afford the cost of treatment of this disease? He or she will not think if I will die of cancer. No, the first thing that they always think is the finances. So this financial toxicity has got impacts. One of the impact can be non-adherence to medication. So a patient might not be able, either the patient might not be able to afford the cost of treatment, or maybe the patient cannot be able to refill the prescription, or sometimes they might be forced to skip doses so that the medication lasts longer without thinking that it is compromising their quality of treatment. Sometimes they do opt out expensive treatment, so they reach a consensus that I cannot afford this, or probably they talk to clinicians if it's possible to reduce some of the medications depending on the socioeconomic status of that patient. Another impact of financial toxicity is keeping appointment. You have chemo and radiation on a daily basis, going to and from. Probably that person is coming from Songea, so it has got implications. Maybe one day that person is not going to have bus fare, so at the end of the day anaweza skip appointments. And another impact is cutting back on basic needs like food, shelter, and clothes. But there are some of the basic needs which are very important for that patient, like diet. So if that person decides to maybe eat one meal per day, it can have a negative impact on the health of that patient. It's another impact of financial toxicity is when somebody uses the retirement service. As we know, most elderly patients are at risk of getting cancer. So at the end of the day, they use up the retirement services, the saving. These are some of the determinants of financial toxicity. We have increased costs like hospital costs, we have lodging costs, we have transportation costs, cost of drugs. We have, for people with health insurance, they can have also financial toxicity because it does not cover, the health insurance covers the medical part, but it does not cover other costs which are indirect and we tend to ignore. So even for those people who do not have health insurance, it can be one of the determinants of financial toxicity. But we have people with reduced income, especially those clients who are sick for a very long period of time. Sometimes they tend to lose employment, and also a lot of days of works, taking 6 shifts from the workplaces, and there's also reduced efficiency at work. The effects of financial toxicity can lead to it can increase the risk of bankruptcy, but it can also decrease the satisfaction of care. It can lead to poor quality of life and poor survival. Now, these are some of the hidden costs. I have mentioned some of them in the previous slide, but I'll just take you through. We have things like medical accessories. We can have artificial breasts for people with breast cancer, and we have a wheelchair. People might be able to, people who are receiving chemotherapy, they might buy very expensive wigs, or maybe buying BP machines to monitor their day-to-day blood pressure. But there's also missing from work, losing job, eating out, lodges, traveling costs, fuel costs, buying new clothes because they've definitely lost a lot of weight. So cancer expenses are rising due to the following things. We have the aging population. As we know that the more that we grow older is a risk factor. So you're more likely to get a lot of comorbidities. So at the end of the day, cancer becomes one of the risk factors, which at the end of the day, it increases cancer expenses. But we also have improved access to treatment. Yesterday, there was a presenter who talked about CT scan. There are about 50 CT scans in Tanzania currently. Now, since we're improving access to treatment, but if we are not careful, if we are not choosing wisely, there's a very big possibility of overutilizing these resources, ordering CT scans left and right without looking at the financial implication of the patient. And this later on increases hardship to the patient. But we also have a lot of innovations currently, like there is a dryer where people who are receiving chemotherapy, they wear the hair dryer so as to prevent hair loss. It's called scalp cooling caps. Such innovation is a very good thing because one is going to receive chemotherapy but with minimum hair loss. But at the end of the day, there is an implication to the patient. It increases cost to the patient. So, since we have seen the problem, now we are going to look at the mitigations of financial toxicity. There are two questions that we are supposed to ask ourselves. Like, is this the right decision to add the drug to the formulary or not? We do have different molecules coming in and they're being developed on a daily basis. But before we add these molecules into the formulary, we're supposed to ask ourselves, is it cost effective to my patient? Will it have a clinical significance to my patient? What about the social economic status of this patient? Can he or she afford it before I initiate prescribing this drug? And who will pay for the drug? Is it the patient? Is it the drug? Is it the government? Is it the health insurance? So these are the kind of questions that we're supposed to pose before we add drug to the formulary. Another mitigation is the physician and patient level. Now we're supposed to increase awareness on low-level practices. These low-level practices are like using expensive chemotherapy in palliative care. These are some of the examples, like ignoring cheaper drugs in supportive care. So we're supposed to increase awareness, and a lot of research has to be done on this area, the low-value practices. So we're supposed to increase awareness so that we can eliminate them in our daily practices. Then we can mitigate financial toxicity on a hospital level by considering the cost transparency. Patient, before initiating any therapy, we're supposed to look at the whole regime, the whole process that the patient will undergo. So if we look at the cost transparency, a patient has the right to know the possible cost of his or her treatment. It will help that patient to plan for it prior treatment, and even possibly it can even make the patient to open up on the social status that he or she has, so that you can even change the regime of the patient. But we have another mitigation based on the hospital level. It's encouraged to have availability of a financial counselor in the hospital. This will help the patient to counsel that person on psychologically, so that that person does not abscond on treatment. But also I talked about elimination of low value of practices, especially for us healthcare professions. Another mitigation is as healthcare providers or as clinicians, we're supposed to look at the treatment goals. What are the treatment goals of my patients? Is it to cure my patient? Is it to prolong life? Is it to palliate, or is it to experiment? So if I know that this patient has got 2 to 3 months to live, I'm not supposed to put that patient on aggressive or expensive medication so as to improve the end of life of that patient. So we're supposed to think of universal health coverage as a direction and not as a destination. We might think that maybe having universal health coverage is the solution to financial toxicity. It's not. It's just a direction. There are a number of things that we need to consider, especially the hidden costs of the patient that encounters. And these are some of the opportunities or simple solutions for simple solutions, like maybe banks or different organizations can offer loans at a cheaper interest rate to families affected by cancer. But also we can build cancer centers in other parts of the country. Like so far, there are different cancer centers in KCMC, in Bugando, in Mbeya. So we are definitely going somewhere. But also, we need interventions to improve employment opportunities and special employment programs for cancer survivors. But also, such employment opportunities could be provided together with loan subsidies so that cancer survivors will pay back the loan with the salary in long term. To conclude, financial toxicity is probably the most important barrier for cancer care in low and middle income countries. So you cannot know what you cannot measure, and you cannot solve what you cannot know. So a lot of research needs to be done on this area, and also we need to address this problem, because this problem is definitely a man-made problem and it is solvable. So with that being said, that's a diagram where we see a pharmacist giving drug to a client, but that client's question is, what I'd really like is something that will cure the high cost of medicine. So this patient does not see the disease as a problem, but sees as high cost of medicine as a problem. Thank you.